I cannot imagine what life in Pierce County would be like if we did not have community health care.
In 1969, I was just elected president, PLU, and the citizens asked me to be the chairperson of the Urban Coalition. And on the board was Dr. George Tambera, who I'm not met. He came up to me and he said, I got an idea for you. The idea was the East Side Shalishan area, and that became our first Tambera Center, which was a Quonset hut. He and his wife, his children helped out too. Jim Walton was executive of the Urban Coalition at that time. So that's how we got started.
Well, I had helped train the interns at Pierce County Hospital, and I also serviced the pediatrics of the tuberculosis clinic there. And unfortunately, because of the usual problems of finances, they had to close it down, and people had no place to go. So when the mayor asked if I'd be interested in joining the Urban Coalition, and of course they had good administrative people.
Well, Jim, you were there.
Well, in reference to the Urban Coalition, it was a national organization with the local branch, if you will, and the idea was to be representative of all of the major segments of community, to bring together the movers and shakers to do some problem solving. Access to health was a big issue, especially in the east side of Tacoma, as Dr. Tambera had talked about.
Lister School offered their family rooms, so we started once a week on a Wednesday night with just volunteers.
Well, I just remember back to when I was in high school. I used to go with my father to Lister Elementary School, and I know that it was a combination of a lot of volunteers because we used to stop by Puget Sound Hospital, pick up peanut butter and jelly sandwiches and flat tuna fish sandwiches that they provided for all the volunteers. I know there were Explorer Scouts, and they're taking histories of the patients before the physician's exam. And I know that I was there to help with the eye exams and the ear exams, and it was just one large room. And I think my father told me later that they actually did the exams on tables or desks in the classrooms.
Well, around 1973, I was the administrator for Pierce County from the state government for drug treatment and mental health funds. And there was a need to spend some of this money for the clinic services. And I was made aware of community health care in that capacity.
1980 sort of begins to talk about the period of time when my involvement began. We had two clinics, Eastside Clinic and Family Clinic, I believe at that time. One operating in the Salishan area, the other operating on the Hill. But every year there was this question of, do we have enough to keep going? Do we have enough resources? And so we went to the federal government and said, we have a medically underserved area.
Well, many of the things that prompted, I think, the formation of that Eastside Clinic are still issues that are relevant today.
Well, I'll start with a roadblock. That is, it's still like many nonprofits think that they themselves are always the best kept secret in the community. And the successes, I think, is of the 100,000 that are eligible, I think community health care is able to take care of about 36,000, 1/3 of them being children.
The capacity to respond to people who have healthcare needs but don't have an insurance plan to cover the cost of doing it, don't have a provider to see them regularly every month. We've now provided a way for them to have that access and to get that care and to live a more healthy life.
This is a big deal, and this is how communities work. This is how you take all of these resources, orchestrate them, align them, get them to really provide value to the members of this community.
We really have to thank the governmental people as well as the legislators, because they're all very supportive.
One of the governmental people who has made tremendous contributions to this community, that's Norm Dix.
Speaking of Norm, we would never have gotten a population designation without his commitment, involvement, and how do we find ongoing funding to support this access to health care. Without that involvement, I don't think we would have turned a corner with the federal system to get them to do something they'd never done before.
Anybody who works on healthcare issues knows that there is no finish line. As long as that occurs, we need to have programs like community health care in full gallop.
I'd like to get the last word in. So I'm all for 51% prevention, even though it may be costly, and 35% intervention, which is costly, but that will decrease the episodic to 14%, not only in time but finances in the long run. Like everything else, if you do the prevention first, it'll decrease it at the end.
It's just part of the ongoing struggle. We will dare to struggle, but we will also dare to win.